Thank you all for joining. And if you're just coming in, thanks for spending some time with us this afternoon. If you're on the West Coast, or also on the East Coast as well. Hey, Keaton. My name's Dr. John Huang. I'm a physical therapist and one of the provider leads at Regenexx. And so we are really excited today to have our guest speaker for a little Q&A. This is Dr. Stephen Darrington of Derrington Orthopedics. He is a Regenexx physician and orthopedics interventional specialist that practices in Southern California. I had the honor of having a couple mutual patients with him. And so we've kind of developed a nice working relationship over the last year, last crazy year. And so I'm excited to kind of chat a little bit more about what he does and then see, I know we have a lot of PTs, a lot of PT students, rehab specialists, movement specialists, other healthcare providers that are going to be joining us and may have questions about what regenerative medicine is exactly. And so I have a list of questions that people had asked beforehand, and we'll kind of go through them. But first things first, we'd love to hear just kind of a basic need to knows of who you are, the SoCal stem cell doc, where you practice, when you started, that kind of thing.
Cool. Well, thanks, John. Thanks for having me on. Yeah, like you said, Steve Darrington, the owner and CEO of Derrington Orthopedics. It's a interventional-based regenerative medicine practice that I started about a year ago. I actually took over an old practice that was called Healthling Medical Center, and I've got offices in Oceanside, California, and in Laguna Hills, so San Diego and Orange counties. My kind of little background on me, which kind of helps understand how I got to where I am today. I'm a DO, so I'm an osteopath. I'm a physiatrist, so physical medicine rehabilitation trained, and then did subspecialty fellowship training in interventional spine, sports medicine, and regenerative medicine. So a lot of you guys that are on may already know what an osteopath is, a doctor of osteopathy. Similar training to an MD, but a lot more manually focused, using our hands, understanding the importance of the musculoskeletal system and how it should be working optimally together for health, and understanding the connection between structure and function, and really harnessing the body's natural ability to heal. Physical medicine rehab is a specialty also called physiatry that is basically focused on optimizing function. I've obviously focused more on the orthopedic side of things. Others might focus on neurologic problems like brain injuries and strokes and spinal cord injuries. But the goal is to get people active, doing more, and ideally with less pain. And then my fellowship training was really focused on using diagnostic tools to make the diagnosis, but also very precise injection-based treatments to address all kinds of orthopedic issues. And that could be anything from a joint problem, like arthritis or meniscus injury or a labral injury, rotator cuff tears, ligament injuries, disc problems in the back, any number of things like that. So all those things kind of fit together well to take me through the path that I've been on. I don't think I knew where I would be today, 10, 15 years ago, but everything has really fit well and kind of prepped me for the next step, which is pretty cool.
Awesome. I think that was a great kind of starting background for what we want to discuss, and also leads into my next question. And this is something that I've kind of not struggled with, but just always had questions, not quite so much clarity about, is talking about injections and talking about injections with patients. Because when patients come in and say, oh, I had an injection in my shoulder, they oftentimes don't really know exactly what that injection is. And so there's some confusion on was it a corticosteroid shot? Was it PRP? Was it stem cell? Was it prolotherapy? Can you kind of do a very high level explanation of between those four things? What are the key differences? Which ones do you do specifically? And what should we think of as healthcare providers to help educate our patients?
Yeah, that's a good question, because there's a wide range of different injections, and that's not even comprehensive to other stuff. But those are the kind of main ones that people will probably come into your clinic with. Corticosteroid, cortisone, there's all kinds of different brand names, but those are basically, they're strong anti-inflammatory medicines that have pain relieving properties to them. And they can definitely give short-term benefit. They can reduce acute pain, whether it's from an arthritis problem, a rotator cuff problem, a back problem. And sometimes that's enough to get you to break the cycle. So you can get through physical therapy, you can tolerate some of the movements and be doing really well. Oftentimes they are short-lived. They only last like 3 to 4 months at a time. So commonly they're repeated. But we've got to be cautious with how often you're repeating them because they can cause damage to ligaments and tendons. They're actually chondrotoxic, so they're harmful to your cartilage. So if you've got a knee, a knee problem, you've got arthritis, and you get a cortisone shot, it makes you feel better. It's really just masking the symptoms, and it's actually can be making the cartilage problem worse. So I've chosen to not do those injections, but that's still probably the most common injection that people are going to be receiving. Getting into the kind of the regenerative medicine direction, that's usually where prolotherapy, PRP, and stem cells come in. Prolotherapy is short for proliferative therapy. It's actually hypertonic dextrose, or concentrated sugar water, that creates some local inflammation. It can be used for joint problems. It can be used for ligament tendon problems. Oftentimes is a series of injections done over some period of weeks and even months. Could take 6 to 8, 10 treatments sometimes. But it's something that is actually kind of trying to work with the body and initiating a healing response, which is what the whole field of regenerative medicine is trying to accomplish. Then kind of step up, if we're thinking of kind of entry-level regenerative medicine treatments, the next one would be PRP, which stands for platelet-rich plasma. So basically, it's a process of concentrating the platelets from our blood and isolating them from the red cells and the white cells. And the reason that can be helpful is there's lots of different growth factors and cytokines that are in those platelets that our body normally uses to help heal, a cut on your skin or a pulled muscle or even a broken bone. And these kind of treatments basically initiate a much stronger healing response through those growth factors to help tissues heal and to reduce inflammation. So they can be pain relieving, similar to steroids. They don't usually work as fast, but they oftentimes work much longer. They can be more significantly, beneficial, and they don't cause some of the side effects of the cortisone that we talked about. There is a limit to what PRP can be helpful with. Well, a couple things, I guess. We won't get too much into this, but there's lots of different types of PRP, and as we talk about stem cells, different types of stem cells, and it's not all the same, just like not all injections are the same. So there's some differences that can come into play. So when someone says, I had a PRP shot, it's just not the same as saying, well, you had that. I know exactly what that is. There's a wide range of what that could be. And getting into stem cells, there's different stem cell sources. Some of them, I think, are mislabeled as stem cells and aren't actually a stem cell procedure. The stem cell procedures that I do are actually using bone marrow from that same patient and concentrating the stem cells and other progenitor cells that are basically able to initiate a much stronger healing response than what the PRP is able to do through the growth factors. So I think that's a pretty good just kind of starting point. Like I said, I could talk about lots of those different topics.
Sure.
A lot longer. I think for getting some basic intro, that should be helpful.
That's great. I do have a follow-up question to that. So you mentioned kind of like entry level versus next level versus stem cell being the last. Is that something typical when somebody comes in with a degenerative disc disease, or they start with prolotherapy, and if that fails and goes to PRP and then goes to stem cell, or do you jump straight to one if you think?
It depends on a number of factors. One is the severity of the problem. And we know, like I mentioned, some places where PRP just doesn't work as consistently as stem cells do. Obviously, as we step down, obviously the same thing can happen with prolotherapy, where some things just are not as likely to respond with some of the other treatments. So, as part of the evaluation and the examination, reviewing outside records, reviewing outside imaging, I'm able to most of the time be able to get a pretty clear idea of what I think is most likely to help. The starting point for the patient may be, I want to be more cautious with this. I want to start with prolotherapy. I understand that it may not be good enough, but I want to try it because it's the easiest. It doesn't require any kind of blood draw or anything. It's typically the least costly. And for some patients, it may still give benefit for even in a situation where I might be recommending something stronger. But that's a collective decision that I kind of help the patient make through some education, but ultimately it's up to them as far as what they do. I will say that any of
Awesome.
those are probably better than a cortisone shot, just because it doesn't have some of the negative consequences, not only to the local environment, but more systemic stuff that are important to be aware of as well.
Awesome. We have a question in the comments from Blue Eyes 2040. It says, what are your thoughts on Mesoblast's phase 3 results for the stem cell therapy for DDD? Will you be partnering with them once they receive FDA approval, expected in October 2021?
Yeah, so that's a great question. Mesoblast is so there's several different FDA in the process, different therapies that are out there. Regenexx actually has one that is in that process as well. So as that comes to being available and it shows good promise, yeah, I'll 100% jump on board, because I think that if it shows better promise and allows us to treat additional things that maybe the things that we're able to do legally in the U.S. Struggle with, then I think that's a great option for patients. That's sort of getting into the FDA approved versus FDA compliant way to treat things, which is kind of a whole different discussion. But obviously, if we're talking about a manufactured product that has FDA approval, that is considered a drug and requires that FDA regulation. The things that I do in my office are considered FDA compliant. So the ways that I process and do minimal manipulation of whatever I'm working with is basically regulated under the California state medical license that I hold. If someone is in another state, that state license covers that as well. So these are things that aren't considered drugs in the eyes of the FDA because we're not doing certain things. Obviously, there's other options that are out there where you are doing more manipulation, even if it's from that same person. But again, may have some advantages over what we can do legally right now. And that's just where this field is going to continue to evolve, I think.
Awesome. Appreciate that. And thanks for that question. So you mentioned Regenexx, and I think that's a name that pops up quite often. And I'm curious, what does it take to become a Regenexx licensed or a certified doctor? And what kind of support do they give you in terms of, the types of treatments you're able to do, the continuing education, that kind of thing?
Yeah, that's a good question. Regenexx is, so Regenexx started with a private practice called the Centeno Schultz Clinic. Chris Centeno, John Schultz, 16, 17 years ago now. And they have since created an affiliate system where physicians with appropriate training can become part of the network and take advantage of basically their hard work that they've done for years. So that started with, so I guess let me back up. So that Centeno Schultz Clinic was the first clinic to use bone marrow stem cells to treat orthopedic conditions in the U.S. So they have the longest history of anybody in the U.S. doing this kind of medicine. They had the foresight at the very beginning to collect registry data on those patients. So patients that have been treated in the past, they fill out questionnaires asking about their pain. They fill out validated functional questionnaires, and are able to track those outcomes and see how patients are doing for different conditions. So we learn a lot through that and seeing what kind of patients do well with what procedures and what kind of procedures maybe don't work as well for certain conditions. So that allows us a lot of really powerful information, not only for the clinician, but also to give to the patient. So the registry data is a very, very big advantage of the Regenexx network, but not anyone can become a Regenexx physician. You have to have some basic educational training. You have to be a physician, either an MD or a DO. You have to be in some kind of an orthopedic field, whether there's a lot of PM&R doctors like myself. There's a number of family medicine, sports medicine trained doctors. There's some anesthesiologists. There's even a handful of orthopedic surgeons. But you have to have some of the procedural training using image guidance to direct needles, not just knowing how to do surgery or not just knowing how to prescribe medications. So once you've met the bar, then there's some additional training that you do through Regenexx itself and also through an organization called the Interventional Orthobiologic Foundation. That is a nonprofit that was started to train doctors really around the world on how to do very sophisticated orthobiologic treatments. All of the Regenexx docs have gone through all of those, or have gone through a majority of those trainings, if not all of them. But there's also a number of non-Regenexx doctors that have that training, so we can really elevate the level of treatments that are out there for people like I said, around the world, around the country, and even around the world.
Awesome. Yeah, I was reading a little bit more about Regenexx and on your website, and I noticed that a big requirement is having a lot of background and training in diagnostic ultrasound. And so I'm curious, I know it's getting more popular actually among physical therapists to start getting trained in diagnostic ultrasound for kind of musculoskeletal injury. Can you speak a little bit on what it takes to get trained in that, and then also maybe talk a little bit about the type of equipment you do use?
Yeah, so you've got to, I mean, it's tough. It takes a while. I started using ultrasound in residency, and I was fortunate to train with the former editor of the Journal of Ultrasound Medicine. So a very, very skilled person who world people had to do these, diagnostic evaluations. And then as part of my fellowship, that was a big part of it. And there's a guy that would teach all across the country, Marco Boder. So through those with 3 years of pretty intense training, I got more and more confident, but I'm still learning every day with ultrasound. And there's the diagnostic part where you're trying to figure out, is injured? Is this a rotator cuff, partial thickness tear? Is this tendinosis? Is this full thickness? Is there a large joint effusion? Like, there's all these things that you can diagnose with that, but you have to have that baseline of what is the anatomy supposed to look like? What does it look like on the person itself? And then what does it look like under ultrasound? And then seeing enough normal to be able to evaluate and identify what's abnormal.
Right.
So it's a long process, but it's really rewarding, because it's great to be able to have someone come in your office and basically say, it hurts here when I do this, and I can stick an ultrasound probe on there, have them recreate that motion, which is how most have their symptoms. It's dynamic. It's not usually when they're just sitting there.
Preach.
And we can make good, live evaluations and really figure out what their problem is that may be hard to diagnose with an MRI, where you're just laying statically in the machine, not having any symptoms. So I think it's a valuable tool to have from a diagnostic standpoint. If you're trying to devise a rehab program for somebody and you don't know what their pathology is, that can really give you some good information. I do think it takes a lot of training on your own, but also taking courses and working with well-trained people that you can learn from. But I think for me it's invaluable. I couldn't do half the stuff that I do if I didn't know how to use ultrasound from a diagnostic standpoint, but also from a procedural standpoint, which is kind of a separate aspect of it. But that just allows you to treat almost anything all over the body with some combination of the ultrasound or fluoroscope, which is like a live.
Right. Maybe that would be sorry, go ahead.
I was going to say, so you're asking like what I use, and I've got a Mindray TE5 portable ultrasound that I can take back and forth between my office here in Oceanside and Laguna Hills. It takes really great pictures. It's pretty good, from superficial all the way to deeper structures with linear, curvilinear probes. So depending on the frequency, the shape changes, and allows you to see different clarity of tissues and see different depths of tissues. So having a good quality machine is important. But the nice thing is there's getting to be cheaper and cheaper options with handheld devices that you can plug into your phone and get some reasonable pictures. It wouldn't be valuable enough, I don't think, for me with how I treat things. But for someone who's just getting started out, low cost of entry to get something, and you can just get familiar with what things are going to look like. And if you're looking at mostly superficial structures, you're probably going to get some decent pictures, and you'll get a lot of good information.
Awesome. Yeah, that's actually what I was going to ask a little bit next, but actually we won't get into too much of the product detail. Actually, we have a question in the comments right now, and Blake is asking, it seems many are interested in regenerative biologics as a conservative alternative to surgery. What role, if any, do you feel PRP stem cells play in post-op and long-term care? And this is for someone who has undergone surgery in the past or is part of or as a comprehensive plan leading up to a surgery. Yeah,
so I treat a fair amount of patients post-surgically. There are some indications, like in large rotator cuff tears. We've got a full thickness retracted supraspinatus tear that's 3 centimeter gap. There's no way that anything that I can do from an injection is gonna fix that. So I've teamed up with some surgeons occasionally to treat the patient after that surgery is done. So after the mechanical, physical part of the tendon is back, have pack down, the regenerative treatment can help that surgery to work that much better and help that initial healing of the tendon. There's actually a study out of France where an orthopedic surgeon looked at rotator cuff repairs just as they're normally done versus being augmented with a bone marrow stem cell procedure at the time of surgery. And the 10-year outcomes are significantly better for a lack of a lower re-tear rate and a better initial healing. So, it just makes sense that if these biologic things are doing something structurally to the tissues we're treating, if you can approximate those edges when they're too far apart, then that can be of additional benefit. Now, when I usually see patients, it's in this surgical situation, it's either leading up to it and hopefully we can avoid the surgery if it's appropriate, but also afterwards where, I saw someone yesterday that had a partial meniscectomy and just an arthroscopic debridement. So they basically just cleaned out the cartilage, kind of shaved things off, smoothed things down, and then cut out part of the meniscus. She did well for 6 months, but now she's having symptoms again, and it's very similar to what she had before. And because there's not much left for her to have surgically removed, she's looking at a replacement. So a lot of times this can be ideally we're seeing people before they have surgery to try to keep as much of the native tissue there as possible and have more to work with, but it can still be effective in post-surgical cases when you're having symptoms. Now, kind of a separate caveat, and I had a few patients that come to me with this kind of presentation where they're actually doing well after surgery, but they know that surgery that they had increases the chance that they have arthritis later on down the road. Some patients that are really thinking proactively and saying, hey, I'm really active. I plan on being active for 20, 30, 40 more years. What can I do to potentially slow down that degenerative process? And using, these orthobiologics have the potential. Now, we don't have data to say for sure that it's going to prevent anything, but if it can slow down that process and have the environment in the knee and the tissue in the knee or whatever body area we're treating be healthier and be stronger, it's reasonable that would put you at a better position down the road than you would be if you did nothing.
Right. And that's a great lead into the next question. So how often are you suggesting or prescribing or recommending people get complementary treatment along with your injections? So obviously physical therapy and other stuff, wellness training. How often are you doing that? And in what case would you think, or what type of population do you think it's most appropriate for?
It's almost 100% of the time. I mean, this is super important, because what I'm trying to do, with my physiatry background, but what I'm doing with these procedures here is I'm trying to get people to be more functional and reduce their pain and get them they're coming to me because they want to be active, not because they want, pain meds just to mask their symptoms for a while. They actually want to be out doing more. And sure, as you guys all know, that part of whether or not it caused it, but definitely contributed to their presentation to me, there's going to be some biomechanical component to it. There's something that they're doing, that they're aware of or not, to be causing something in that area where I'm treating, and maybe even other areas just from compensation. So that good rehab afterwards is super important. I give everyone a rehab program, but ideally they're going physically into somewhere to coordinate with that program to make sure that they're moving correctly and that they're doing the exercises right, so they're able to gain that strength and gain that better movement mechanics going forward, so they can sustain their benefits. So that's super important, and almost every time.
That's music to my ears and to everybody's ears on this live probably. So we just have about 5 minutes left, and so we're going to take this last 5 minutes to do a little lightning round type of question, just to get you to know you a little bit better. And then at the very end, I want to make sure that you get some time to talk a little bit about your practice and how people can get in contact with you. So I have some questions here, and knowing a little bit about your background, I kind of customize this. So this is on a sticky note. So as quick as you can, I'm going to give you some choices. Angels or Dodgers?
Braves.
Okay, Braves. Pizza or sushi?
Ooh, pizza probably.
Last book that you read?
I've read so many business development books now that I'm running my own practice. The one I'm in the now was Profit First, that I think is imperative for anyone who runs a practice to keep your numbers in order so you can stay open.
Profit First. I like that one. Where's the first place you're going to travel post quarantine lockdown?
Probably Hawaii. We had plans for a France trip this fall, but it may be too early for that. So probably Hawaii.
Awesome, awesome. So non-healthcare, what other profession would you be in if you were not in the profession you are in now?
Oh man, if I was a little bit taller and threw a little bit harder, I'd love to play baseball. But
Nice, nice. Yeah, I know you have a history working with baseball players, and you were a college player too. We can talk about that next time.
yeah.
What was your favorite childhood cartoon show?
Oh man, I didn't watch that many cartoons. Really. My parents limited how long, and they told me to get up.
I was the same way. Awesome. And if you could given that a lot of physical therapists are on this, what is the one piece of advice you would in terms of how to approach a physician or a DO like yourself or a Regenexx physician and kind of start that connection networking with people?
I mean, I think just reaching out. I'm constantly, and part of how I met John, I'm looking for people that can help me with my patients and really help my patients get that much better outcomes and developing a network of people locally, but also, across the country. And, everything's so easy internationally now, starting that conversation. I'm always welcome to answer questions, and I learn from you guys all the time. So just reaching out to me, whoever it is that you might be interested in. Most people are open to that. And, that continued dialogue and all of us, continuing to learn more about what's out there is just going to help us be better at our jobs and help our patients get that much better.
Awesome. Just sneak in one more question before we sign off. Are there any publications, articles, journals, or things like that, resources that you would recommend for people that are just wanting to learn more about regenerative medicine? So maybe a website or somewhere that you can go to get some nice, good information?
Yeah, I mean, there's so much out there. It's kind of hard to. There's not. Well, I mean, it's on PubMed. You can go look on there. Dr. Centeno actually does an annual summary of all the regenerative treatments that are out there that have been published each year. He's got a little. Basically, you can hyperlink onto each one of them. So if you Google, I don't have a direct link for that. If you Google.
That's okay.
If you Google that, you'll find it. He actually wrote with one of his former fellows a really good kind of more or less up to date at the time of just where we are with this whole regenerative medicine field. It was actually published in the International Journal of Sports PT, I believe, called Past, Current, and Future Interventional Orthobiologic Techniques and How They Relate to Regenerative Rehabilitation.
What was the name of the author?
The International Journal of Sports Physical Therapy came out in April 2020.
Okay. And who was the doctor you mentioned?
Chris Centeno and then Sarah Pastoriza, Pastoriza. And it actually dovetails well with what that rehab program should be like and how are these treatments working at different phases of time. And, part of that communication with whoever therapist I'm sending patients to is kind of understanding how do we get people through this recovery process, because it's different than if you got a steroid shot. It's very different than if you had surgery. So especially as you as a practitioner, if you're not familiar with that, getting more comfortable with it, asking questions and getting that experience with it is going to help you give that much better care for your patients.
Awesome. And that is right on the dot. Where can people connect with you? Where do you prefer to be connected to? Social media, email? What's your gig?
I'm open to anything. I mean, my email is pretty simple. It's drdarrington@derringtonortho.com. Last name is D as in David, ERRINGTON. Social media is fine too. I'm on Instagram, Facebook, SoCal Stem Cell Doc. I think it's probably written on here somewhere. So yeah, reach out with any questions, whether it's what to do with the patient or you think you might have someone that could benefit. A lot of times I can help, answer that very, very just basic question and then dive deeper if we need to. But see what it's appropriate for, for them to, help them get moving forward.
Awesome. Well, thank you so much, Dr. Darrington, and thanks everybody who is tuning in. I know there's a few other questions here that are maybe a little bit more specific. You can direct message Steve later.
Yeah, definitely.
And once again, this is the Movement X page. We're going to be doing a little bit more of these IG Live interviews in the future. So if you've enjoyed this, be sure to comment on this video. And then we are going to be posting this on our IGTV page, so you can watch this later in case you missed some of it before. So once again, thank you, Dr. Darrington. If you missed the beginning, Dr. Darrington is a regenerative medicine DO who's based in Southern California, has offices in Laguna as well as Oceanside, right? Or Carlsbad?
Yep. Oceanside.
Awesome. Cool. All right. Well, thank you so much. And thanks everybody for joining. Steve, I will talk to you later. Have a great rest of your day, and we'll talk then.
Awesome. Sounds good. Thanks, Chuck.
All right.